This is Dr. Michael Tapper from Lenox Hill Hospital and the Hofstra Northwell School of Medicine in New York, joining you from the Infectious Disease Society of America annual meeting, also known as IDWeek. And I'm joined today by Dr. William Schaffner, an old friend and a distinguished colleague from Vanderbilt University in Nashville, Tennessee, where he is a professor of both infectious diseases and preventive medicine and a longtime spokesperson for IDSA and other groups on issues related to immunization. And what I'm really looking forward to hearing is your thoughts, first of all, in a timely fashion, because we're just about to head into the flu season, about issues related to immunization for influenza this year. And if we have time, perhaps we can touch on some other critical influenza issues coming up, influenza immunization issues coming up.
Sure. So, Mike, it's good to be with you. And as regards influenza immunization, you know it's very easy. If you're older than 6 months of age, you should get vaccinated, right? That's right. The CDC recommendation.
Although some big changes this year, particularly as related to the live attenuated vaccine as well.
Yes, but so let's first say we should all get vaccinated. We don't have to think about whether we should vaccinate all of our patients. And this year, the live attenuated vaccine is not available, or I should say, it's by the CDC's Advisory Committee on Immunization Practices, it's recommended it not be used. And that's because a component of that vaccine, the H1N1 component, for at least 3 seasons has really underperformed. And we still don't know why. I think
it was a surprise. The data and the recommendation on the ACIP made perfect sense, but the reason, as you say, why that vaccine, which was many kids liked, obviously, many pediatricians, many family practitioners would like, because it did not require an injection. So that was kind of a surprise this year.
It was a surprise to my grandchildren.
Yeah,
but
to balance it off, we have a number of newer vaccines this year, including an adjuvanted vaccine. We have some new formulations, and we have some new companies or merged companies who are in the vaccine market as well. So that's good news.
Yeah, I mean, the good news is for people age 65 and older, now we have 2 specially formulated vaccines. The high-dose vaccine, which has been with us for about 5 seasons now, something like that.
That's right.
And a new adjuvanted vaccine, which also immunologically performs better in people age 65 and older than the standard preparation.
Right.
Now, the CDC's Advisory Committee has not made a preferential recommendation, but just speaking individually, in our neck of the woods at Vanderbilt, we are promoting the use of those 2 products for people age 65 and older.
Including your own healthcare workers as well, because they're an important component of the annual immunization program.
2 weeks ago, we had Flulapalooza, which is the occasion, the day when we vaccinate everybody in our institution, and that includes the people on the undergraduate campus. And we had standard dose vaccine available, and of course, the high dose variant and the adjuvanted vaccine also.